Thanks. And the meeting is being recorded. I'm really excited to be here with you all tonight. This is our first coordinated council meeting for our IFSP regional councils, which we'll explain a little bit more about. But we're really excited for the topic. We're excited to have all of these people here. So on behalf of the IFSP staff, I say welcome and thank you. And before I get started, I just want everyone on our staff to just do a bit of a hand wave when I call your name out. Carly Blake is our community coordinator. We also have Rachel Vimenta, who is our communications coordinator. We have Stephanie Logan, who's our funding specialist and our community support specialist. And we also have on our staff 2 peer specialists that support us in our regional work. For the Western region, we have Kristen Springer, who is with us tonight, and we also have Rafael Hernandez, who's joining us as well. So on behalf of the staff, thank you for joining us. We are super excited, and we'll go ahead and get started with the meeting. So if you can go to the next slide. Our agenda for tonight, we are going to, obviously we've welcomed you. We're going to do a quick commercial sort of telling you a little bit more about IFSP. Fortunately tonight, we also have Mary Miller, who's going to talk to us a little bit about a topic that is important to her, so I won't steal her thunder. And then we're going to have a presentation from Sarah Wilson from NAMI of Virginia, who's here with us today. So we're super excited. And then we have some regional breakouts where you'll be able to meet people from your local community who can talk a little bit more about what resources are in your community, specifically around the topic of mental health, behavioral health, crisis prevention services. And then last but not least, we'll come back together in this room and we will do some question and answers from the larger session, and then we'll ask you to make sure you give ourselves, we'll ask you to complete a survey so we know how this meeting worked for you all tonight. So thanks, and we're going to go to the next slide. We always just kind of say this up front with our ground rules. Tonight's session is being recorded, so if you joined a little bit later, please know it is recorded. We like to tell everyone this because we want you to know that this is not a place where you should share personal information, because there are people on this call and we prefer that you not do that. If you do have questions or personal information that you need to get in touch with someone with the IFSP program, there will be instructions in the chat that will tell you a little bit more about what you can do. And also at the bottom of the slide, you see that there is an email address where if you have technical assistance needs, you can contact someone using ifspcommunity@dbhds.virginia.gov. Remember, the chat is visible to all attendees. So remember, please, again, remember that you are in a public setting, and then also, again, the reminder about personal information. So we will go on to the next slide. You might have heard me preview that this is a new event type for us. In the past, we used to have our IFSP council meetings. Each council would have their own meeting, and we would have 5 different meetings across the state in the months where we would have regional council meetings. The exciting thing about all of the things that have happened to us in the past year or so is, even though this was a lot to deal with for everyone and families in particular, we knew that there was an opportunity for us to maybe be able to share some resources across the state in a little bit better way, and in a way that would also sort of share some common topics that people cared about. So we've moved to this format where we will have a regional coordinated council meeting, which you're currently in. We're doing it all virtually. The breakout rooms will be by region, and we'll give you a few minutes in your regional council meetings to be able to talk about some council business. You might get some updates there, maybe a little bit of information sharing. We'll do an expert introduction, so that's someone in your community who can talk about some of the specifics of the topic that were covered in the larger meeting. You can talk about in that breakout session, and then we'll leave about 20 minutes for discussion. And once we're back, we'll come back to the main session. So if you are putting questions in the chat, we will answer the questions that are put in the chat during the larger presentation. We will answer them when we come back to the breakout room. So again, we're excited about the format. And if you could go to the next slide, Carly. Just in case you don't know where you are or what this is, some people do know what IFSP is about, but just as a reminder, we have 4 different program components. So we have our relationship with our peer supports for families and people with disabilities who are interested in having a peer support with to work alongside them. And we have our partners at VCU are on this call tonight from the Family to Family program. They support our regional council work, and you'll get to know them more in the breakout sessions, but they support our family peer program. And then also we have the ARC of Virginia, which has support for self-advocates. Those are people with disabilities who are helping each other sort of make sure they set policy or think about larger systems issues, and also just supporting each other in navigating a really complicated system. The next piece that we also have is Senior Navigator, which is our My Life, My Community site. And just a plug for that, we will post the information from this meeting on our Facebook page, but also we will post the notes from this meeting. They will be posted on that site through our digest. So if you're just looking for a good place to start in a wealth of information, the My Life, My Community website is a great place. And then we also have a call center that is operated by My Life, My Community. The funding program, which lots of people know about, is also a part of the IFSP program as well. I just want to say out the gate, we do not have an additional funding update for people tonight. So I know there's some people who might be on the call who are hoping to hear an update. Our most recent update is posted on the My Life, My Community website. And we encourage you that if you have a question or you're just looking for some additional information about the funding program, to go to the My Life, My Community website. It'll be dropped in the chat for the link, and it's also in the meeting notes for this as well, if you want to see more about that. And last but not least, which Carly, I think we can go to the next slide. Yep, right there. You are in the part of our program where we do our community coordination. These are our state and our regional councils. This is really where we work together to provide social and emotional support for families with a host of different issues. All of the topics that we are picking for these coordinated council meetings and all of our council work is driven by the input of families. We have family volunteers that volunteer for our state council and our regional council. This specific topic that we're talking about tonight is something that people on our state and regional councils identified as a big topic and something they wanted to cover for a meeting that would be a little bit more in depth and focused on giving more information to families. So this is how we got here. This is where you are. This is what you're seeing. This is the part of IFSP that you are seeing in action tonight. So that's kind of the plug for IFSP. I just want to remind everyone, if you ever don't know how to think about, if it's ever confusing, we do have a YouTube video on the My Life, My Community website. It's very brief, and you can watch the video to find out a little bit about our program if you need something else or that was really fast and didn't give you enough time to digest it. And at this point, I am going to I'm going to pass the mic off to Carly, who is going to introduce Mary Miller from our Eastern Regional, our Eastern Council for the IFSP State Council to talk about National Developmental Disability Month. So take it away, Carly.
Yeah, thanks, Erica. So to start our meeting off, one of our council members from the Eastern region, Mary Miller, would like to share a little bit of something about herself and talk about National Developmental Disability Month. So Mary, if you are able to unmute yourself. Can you say hi?
Hi.
Can you hear me? Hi, Mary.
Do you hear me?
Yes, I can. Would you like me to start? They want you to start, Mary, okay?
Me.
Yeah, here we go.
Hi. Hi. I am Mary Miller. I am the advocate for the IFSP State Council. I am a junior at Kickinton High School. And honor will student. I was asked to talk to you today about something very important to me. As a person who has Down syndrome, I would like to talk with you about my dance classes with the missed responsibilities and emotion program at taught multiply stands stereo in the book. This 10-week long program is a way for us to learn how to dance and to meet people. Not only it's a fun way to meet friends and learn new things, but so singing, dancing, and acting build my confidence, makes me feel better about myself. I have been dancing with Todd since I was 8 years old. That's over 10 years. Dancing with Todd is my happy place. He and our dance buddies show us all the dances moves. Keep us moving to the music. I also surprised everyone when I said my first 3 word my sentence. Dance with Todd. Okay. I have learned more than just ballet or jazz steps. Right here. Right here. Okay. I have met lifelong friends. I have learned how to perform on stage in front of a big crowds. I really love to hear applause I have found a love for music thriller. I can speak in front of a large audience. I have been accepted by my community and feel important. I feel really good about myself. And finding social activities that is inclusive, helpful, can be hard for people with disabilities. Have been lucky to discover some that make my life better and happier.
There we go. Almost done. There we go.
March is a developmental disabilities awareness month. And please remember inclusion. All people with disabilities in all areas of the community is important. We should help remove barriers and prejudice that they may face. Todd is committed to not only people with Down syndrome, but also to people who have the different disturbed disabilities in autism and cerebral palsy. There are now classes offered to them too.
And tell them the website, Mary.
The website information find out about the program is www.tr.dance.org. Then Todd saying to us if it is.
What is Todd saying to you, Mary?
Listen to you. It's a dancer.
Everyone is a dancer.
Thank you for my time.
Thank you so much, Mary. I'm going to show some of the pictures that Mary sent us as well. Thank you so much, Mary. We're so happy to have you on our Eastern Council representing the Eastern region.
Thank you.
All right, and before we get to our main speaker, I'm going to give it back to Erica to talk just a little bit about beauty and mental health.
All right. I know everyone's writing in the chat. Thank you, Mary. That was so nice of you to be able to share that with us. And we will have, I meant to say something that I didn't say when I began, and I'm so sorry I didn't. If you need captioning for today's meeting, there have been instructions that are put in the chat. Please follow those instructions to figure out how to get the captioning. We want to make sure if anyone needs that, they can get it. And I'm going to just do a quick little update, or not an update, but to set this up so everyone knows why we are having this conversation. As you heard me say earlier, the topics that we are picking for our council meetings are topics that have been selected by families just like you. These are topics of concern, things that people want to know more about, and all of them will be different throughout the year. The one that was up first that people really wanted to discuss, and I think it really has a lot to do about the time and where we are in the world and things families are experiencing, is really kind of the connection between mental health and developmental disabilities, and also the being able to figure out how to help people connect to crisis services if they need it. I have the slide up here about crisis services and how to contact crisis services in your community. And I think just to sort of remind everyone, we know that, people with developmental disabilities, some of the mental health concerns haven't always been something that people have primarily focused on, but we think it's a really important conversation for us to have. This is why we're doing it. And this is why we want to talk a little bit about some of the nuance between both mental health and developmental disabilities, but most importantly, to really help people understand that prevention is key. So we did reach out to the folks at our state crisis office. You'll have the regional people in some of the regions that are going to speak to this, but we just wanted to let everyone know if your family is experiencing a crisis or think you might be headed that way, you can reach out for prevention supports. These are the numbers across the multiple different regions. They work on a regional basis, which you'll learn a little bit more about, but these are the phone numbers. We will have this in the slide deck. It's being dropped in the chat as well. There's a link that you can find it on the webpage, but we want people to be able to have access to this information. So that's kind of the setup for what we're doing. I'm going to turn it back over to Carly, right? And Carly, you're going to introduce Sarah? Perfect. So thank you guys so much. Again, if you have questions, you can drop them in the chat throughout the presentation. We will get to them at the end of this conversation when we come back from when we reconvene after the breakout sessions and answer any questions that you have in this session. So Sarah, take it away.
All right, tonight we are happy to have Sarah Wilson presenting in the main session. Sarah received her master's in social work administration, planning and policy practice from VCU. Prior to joining NAMI, Sarah has experience in suicide prevention and crisis intervention work, community organizing, and older adult mental health. Sarah has worked for NAMI Virginia since 2009 in a variety of roles. Sarah currently serves as the assistant director, where she provides strategic direction for NAMI Virginia's programs and presence in the state through coalitions, work groups, partners, and 14 statewide local NAMI chapters. I'm now going to stop sharing and pass it over to Sarah.
Great. Glad to be here, guys. Thanks for having me, and thank you for the introduction, Carly. Just gonna quickly pull up some slides for you all. And I do just want to make a quick disclaimer. I put a ton of slides in here, and I know I only have 20 minutes, so I probably won't get to all of them, or I may rush through a few of them, but I wanted to just give you guys access to the information and you could maybe reference it later. It's not an end all, but it is a starting point. And I also want to say these kind of tend to be more mental health, not co-occurring support. So I think the crisis line is a really great resource for you all. And in some of these where I might suggest CSB, the crisis line is probably an excellent starting point. So first of all, thanks for having me. I wanted to just do a quick introduction about mental health. I don't think maybe it's unknown to you guys, but just to kind of talk about what it is and what it isn't. So, what is a mental health disorder? It's really when the brain is not functioning around mental health. It relates to difficulties with problems in focus, emotions, highs and lows, and sleeping. And of course, we all can kind of relate to that. And certainly, I think it's been a stressful, I don't know, year and some change now. But when these symptoms really start to impact and disrupt your daily life, that is when we really say you might need to call in additional assistance. And that's sort of individualized in terms of where you fall on a spectrum of symptoms. So this is a lot, and I hope you guys can see it, but I wanted to just list out some of the classic warning signs for mental health conditions in adults. And I'm not going to read these out, but I wanted you guys to have them because I know we're sort of focusing more on crisis, but these are sort of key things to look at. And it's really, emotional highs and lows, excessive worries, excessive anxiety, changes in behaviors, changes in sleeping habits, changes in diet and eating, things like that are just out of the norm are usually good signs to start maybe checking in and asking. And I've also included warning signs for children. And so they're a little more behavioral just because naturally, developmentally, kids are going to not be able to maybe express their thoughts and emotions as effectively. And even as adults, sometimes it's hard for us to express our emotions and kind of what's going on inside. So I wanted to put a few of these here just so you guys can see it. And I just wanted to talk a little bit about this. In talking to Carly, I wasn't sure how detailed or not to get, but just to give you guys a brief understanding, what causes mental health conditions, it's complicated. It's got a lot of biological issues related to brain chemistry, genetics that tend to run in families, but it also has a lot to do with environment, substances, chronic illness, trauma, stressful life environment. A lot of these things can complicate and lead to a mental health condition, whether acute or chronic. And because it's not one single thing, it's sort of, these are all things you need to be keeping in mind. And this makes it a little bit tough because unlike maybe most medical conditions, mental health really doesn't have a standardized test. You don't take a test and it tells you what you have. There may not be a classic treatment process. And to kind of highlight this, I just like to share this slide, which sort of highlights the heart. And, the heart, we know it inside and out. It's a 4-chambered pump. It's an incredibly important part of our bodies, but it is also very simple, and we've got it pretty mapped out, and we can test for things when it's going wrong, and we can solve them pretty quickly. And with the brain, to quote Dr. Insel, it's an organ of surreal complexity. We're still figuring it out. It's probably one of the most popular fields to research, but not necessarily to practice. And, we've had some advances, but we still have a long way to go. And so it's, often a mental health condition, whether, or diagnosis once it's given is really based on self-reporting and observations from a clinical staff person. And it's just, there's always room for challenges there. That's not a perfect system. It really depends on the comfort level you have with the provider, the amount of time the provider puts into it, the amount of time the individual maybe has in recognizing their own symptoms and be able to communicate that. So when we deal with mental health, and of course, when it's co-occurring, there's always more challenges, but it's really good to kind of be heads up because the treatment process is sort of a house of cards in some ways. It's a really delicate balancing act. That involves a lot of self-awareness and self-discipline. You can't be a non-compliant patient with mental health. That's not exclusively. There are some shots and things that you can force injections, but in general, therapies are the most proven effective. Sometimes medication is a good complement, but a lot of lifestyle changes and non-traditional therapies can help as well. And so that's something to really keep in mind, and sources of support are really huge because medications will take time. Therapy is a prolonged process. It's kind of hard when you have these really negative experiences like highs and lows and the other experiences that you're having, and it takes so long for change to happen. And so it's a really challenging process. And so just keep that in mind. It's going to be more of a journey than a quick solution. And so when we talk about treatment for mental health, we sort of focus on the word recovery, and we view it as a journey. And these are sort of the 4 components of recovery in terms of managing your symptoms, having a stable, safe place to live, meaningful daily activities, and of course, important relationships and social networks. And so now I'm going to kind of switch to crisis. And so, crisis can mean a lot of different things. In the strictest terms of the law, crisis is imminent danger of hurting self or somebody else. And those are obviously the worst case scenarios. If someone got to a point where maybe their symptoms had them feeling so bad that they felt like that was the only option, or they were so confused or scared that, they might risk hurting someone else, that could be an issue. But in general, crisis, I think for most of you as individuals and also as family members, it's going to be sort of something lower than that. You're going to kind of see the signs coming, and you're probably going to want to maybe define your threshold of crisis a little bit different. But for some of this, I'm really going to focus on like the worst case scenario, and then please always try to start a little bit sooner than that. For worst case scenarios, often the options in communities are going to be hospitalization, which can be voluntary or involuntary. It's usually relatively short term. It can be longer, but not always. Hospitalization is depending on where you go, it could be far away from your home. It can certainly be scary and intimidating. It's a very sterile environment. If you're there involuntarily, you can't leave. Crisis stabilization centers have a little bit more flexibility. They're voluntary. They're a little less sterile. They're a little bit more of a comfortable environment that allows people to feel a little less out of their normal environment in terms of dealing with the crisis that they're having. And they're usually addressing it a little bit sooner than maybe hospitalization. And then, of course, a wellness contract is sort of not the worst case scenario, but maybe the least interactive. It's really trying to de-escalate the situation in the moment and creating a certain level of support to the individual, usually by a clinician, to help them stay safe. So removing maybe objects that they might have a plan to use, making sure that there's family there, that there's a plan to see a provider the next day, that they know that they're safe for a certain period of time. And often when it gets to this level of a very serious crisis, it's all about safety of the individual and those around them for a period of time. And, it's not a long-term solution. So with a lot of this crisis, I would say, try to notice the precipitators to crisis and try to have solutions for those mini crises before it really gets to this point. But of course, you need to have a plan for everything. And that's really what we're going to focus on. Okay, so I mentioned this before, but, we kind of have this attitude of, we hope that there isn't another crisis, but if there is, it's better to be prepared than not. And of course, we also really view that, you know yourself best. If you've managed to survive a crisis in the past, you probably know what might help in the future. And so really starting to think about that and having this plan is going to ensure that everybody on the team, and that could be case managers, that could be friends, that could be family, knows what needs to happen and moves into action. It minimizes stress and trauma for the individual or any other family members or children in the family. And it can also minimize the impact or duration of the crisis. If you deal with it in a way that isn't re-traumatizing, then the individual is going to hopefully be able to address whatever led them to that crisis state and move back to a place where they're functioning a little bit more effectively, coping really successfully. So what do crisis services look like in Virginia? For mental health specifically, this is really what's there, but there are some really great crisis lines like REACH in this region that I think would be great for you. And I'm glad that you all have that information. I'm sure everybody's familiar with the community services boards. They are in every region and locality, and they provide mental health services for adults and children. If somebody they can help with hospitalization, voluntary if needed, but if not, they are the resource for involuntary hospitalization. They would provide the clinical evaluation for a temporary detaining order to hospitalize somebody. There are regional crisis response services available. primarily for kids statewide by region, and they have mobile crisis teams, which are really cool. They'll go see the child where they are, as opposed to with a community service board where you would have to transport the individual in crisis to a hospital, a police department, or the CSB themselves to be evaluated. They won't necessarily come to your house. Crisis stabilization and child psychiatry is also part of that, which is great because we have a real shortage in Virginia of child psychiatrists. New legislation that's out that of course isn't quite in place, but will be soon, is the Marcus Alert in 988. And so 988 will be a great resource in terms of being a crisis line that people can call before it gets to imminent crisis, where they can get support, they can get resources, they can get guidance. The Marcus Alert will be, although we don't know exactly what it's going to look like, it will be a mobile response, mobile crisis response for adults and kids. They're going to probably pull it all together. And the goal there is just to make sure that, you know, whatever is happening during the crisis, we're handling it effectively and in a way that is not going to cause a safety issue to anyone. So that will be piloting soon and statewide, and it will be exciting in the future. The other thing to really keep in mind is that often when it is a severe crisis and you maybe are worried about your own safety, you know, in terms of hurting yourself or maybe hurting a loved one, sometimes the police do need to be called. And if that's the case, you should certainly ask about a crisis intervention team member or CIT. And these officers have voluntarily taken a training that will give them insight and strategies for working with someone who maybe is in acute crisis state due to a behavioral health issue to help de-escalate the situation. Not to say that police wouldn't, but some of the traditional training is more about when someone is non-compliant, you respond with force. And that doesn't always work when someone's in a behavioral health crisis. So that's just a really good program in many communities, not every community. And then of course, emergency rooms, if needed, can be a place that you can go. It's not recommended, but you know, when crisis hits, sometimes you just don't know what's going on and it can be a really good backup. And of course, private hospitals will be good. So these are sort of the general warning signs of crisis. And obviously, as you know, traditional signs get worse, that usually leads to crisis. Something is not going right. So just please think about it. And when I talk about psychosis, it's you know, hallucinations and delusions, but delusions can just be not so grandiose. It could just be, you know, not able to really track conversations, not really able to sort of understand what's going on around them. So, you know, just things to keep in mind, things to look for. And of course, if you see a couple of these, you just need to check in. Everybody's different in what kind of symptoms they're going to display in terms of how they react to stressors and what crisis that leads them to. So, you know, I'm sort of giving this introduction, but you're really going to have to sort of take some time to think about your plan. And your plan is really going to be around what you know has happened in the past and what you can learn from that. Because if you survive that, you can survive another crisis. So, you know, what are the signs? What are the signs for you or your loved one that you're caring about, helping them make this plan? What are the stressors that usually trigger crisis? And when I say crisis, I mean like crisis level 1, 2, 3, all the way up to maybe an extreme crisis. But is it stressors that are cyclical? Do they happen every season? Or are they episodic when something like, you know, a real major current event happens, a tragedy that really sets them off? What happens? And so knowing that kind of stuff helps you sort of be prepared of, am I seeing the signs? Did something happen? What do I need to be watching for? But also what helped in the past, because that's going to be sort of your first step responses to early crisis signs you see. What are the strategies that work? And, you know, having a certain amount of control over your mental health is really empowering and important to sustaining recovery. And so helping yourself or working with someone who's kind of working on a plan like this is really important to kind of help them see like what's worked and maybe what helped. Was it seeing your provider? Was it calling a support line? Was it using the text line? Was it hanging out with friends or doing something for yourself that sort of helps you focus on just, feeling better, whatever it is. And also what wasn't helpful in the past. Did you push somebody into something that they weren't ready for, that sort of escalated their anxiety or something like that? And then, of course, think about the resources that are out there that could be part of your de-escalation tactics. So what needs to happen? Again, the key to a good crisis plan is sort of every level of crisis, from the very beginning to when it gets to a point where something's got to happen immediately. And so when you get to that point that something's got to happen immediately, what is it? You hope you never have to use it, but you need it. So, what hospital will you use? What's the transportation plan? And I will say here, it's good to have kind of two options, because the goal is always to transport somebody yourself. It makes everyone feel the most comfortable, the safest, it's the quickest. But if you feel like you are in danger, if you don't feel like you can, you may need to call in the police, in which case you definitely want to ask for a CIT officer, and try to do what you can to make that situation work out well. There's other little things you just want to think about. Who can you call in to help? And so this may be, for example, if there's other kids in the household, who might watch them if there's a crisis and somebody needs to head out to the hospital. So who's the backup babysitter, or who might come with you, or who might meet you at the hospital that is maybe somebody in your family that's got a medical background that could help sort of manage that conversation. So anyway, those kind of things are just the intangibles that you kind of have to think about in your own situation. And definitely any plan you make, you want to make sure the individual's on board with it. And anybody else that's involved with that plan, so that they kind of know what needs to happen and when it needs to happen. And I'm sure I say it somewhere, but if anybody's involved in the crisis plan, give them copies of the crisis plan. Keep that crisis plan on the fridge if you think it might happen pretty regularly. If it doesn't, maybe just keep it somewhere where you can find it. You do have to do some research, and I am sorry that it's not easier, but you definitely want to not have any surprises. So make sure to talk to your health insurance provider and make sure that, the different options for different levels of, is it going to be hospitalization, crisis stabilization? Do they take your insurance? What are you facing there? What else is available in the community? And I would definitely start with that crisis line. I say the CSB, but if that crisis line is there and has kind of co-occurring understanding, they're the best place to start. I would also, once you kind of know what you're going to do, like if you're going to go to a local private hospital because your insurance takes it and it's 5 minutes away and that's just where you feel comfortable, you've had good experience in the past, you just want to make sure to familiarize yourself with that. When we're in crisis, and let's be honest, if you're the individual in crisis, you're probably going to have a loved one helping you. And if you're that loved one with someone in crisis, you're going to be really worried. And so our brains aren't the sharpest when we're that stressed. So making sure you sort of go through the process of where are you going, what's the admin process, what route are you going to take, practicing some of those things ahead of time, what you'll bring. Sometimes it takes a while, and it's good to have a bag packed with snacks and drinks and anything that's going to help your loved one feel more safe, feel comfortable, able to sort of, contain their coping skills. And of course, you really, I think some people are going to say, oh, I'll always be able to get my loved one to the hospital. And maybe that's the case, but it does not hurt to talk to the police just in case, to kind of know what their process is. Different communities are different, but sometimes you can give them a couple heads up about your household and situations that they need to be aware of, that can track that. So if you ever do call, they sort of see that information. And you can certainly inquire about CIT officers and if they have them in your locality. Okay, so organizing and communicating, I sort of touched on this, but you want to make sure all the important numbers are there. Make it obvious. Don't count on your brain to think something through. The key to a good crisis plan is that you've made it really easy for yourself to take action when you're distracted in a million different directions. Include a packing list. If it's something that you could keep together and you wouldn't miss it, and you think that maybe it might happen frequently, keep a backpack or a duffel bag packed. Your transportation plan, copies of medical records, insurance information, medication info, And then of course, anything that police or like police may need to know, or hospital, and that's sort of, the police are going to want to know if you've had a history of suicide, where the person is in the house, are there any weapons? They're going to ask you a lot of those questions. And so it might just be helpful when you call ahead just to say, what are some of the questions you might ask in a crisis? Just so you sort of know the answers, and you can feel a little more comfortable to answer the ones that you need to answer, and some are situational and you'll just have to work with them on that. Organize the plan and then share the plan. During a crisis, again, try to de-escalate it before it gets to an all-out serious crisis. But if you can't, stay calm, activate the plan, be mindful of where your loved one is in the house and where you are and where others are. And this is really if the person is, making you feel that they're a danger to themselves, they might hurt themselves, or they might not realize, but they're a danger to somebody else. Assess if your transportation plan will work. Keep good records. You really want to note what happened, who you talked to, what they said. And this is kind of like throughout the process, because sometimes it isn't the smoothest. And, sometimes it's hard to kind of get information about your loved one when they're in the hospital. So just really keeping track of that information is important. And if you think they're going to have to be hospitalized, just realize that it may take a while to find an available bed. So, again, that bag is really important, having some snacks, having some supporting things. If it's, headphones with music, if it's a weighted blanket, if it's just snacks and water, so that they've got something to kind of help themselves. After a crisis, it's always important to revisit what happened. I think that's sort of reclaiming the experience. We never want crisis to hit, but if it does, what did we learn from it? How are we stronger from it? And so, talking to your loved one about what happened, what didn't work with the de-escalation efforts that you guys might have tried earlier, or maybe what short-circuited you guys from a level 1 to a level 5, and make sure to kind of update your plan. It's a living, breathing document. Make sure to just notify people on their team, especially their healthcare provider, if this has happened, just so they know. Make sure to just sort of attend to your own stress management. We talk about this a lot, but you've got to take care of yourself if you're going to be in the best place to care for somebody else. And if you want your loved one who's maybe also needing to work on some resiliency and coping strategies, you've got to model it. So modeling that to your loved one is really important, in addition to taking care of yourself. Final thoughts. Again, everybody's situation is going to be different, so there's no one perfect plan. But do get started, build on it. If you're lucky and you don't have crisis in a year, just pick a time to make sure to revisit it. See if those are still good strategies. See if that's still the right contact information. Just make sure to keep it up to date. And just make sure everybody's involved in the process. The best time to make a plan is when everybody's doing well, because then you can sort of talk about the wishes you want honored when maybe you aren't at a point to make that call. So Carly, how am I doing on time?
I will give you the time that you need. We will move to our breakout rooms whenever you are finished.
Okay. I just want to say that we've got some other things, and that we've got resources, information about us in here, and these are all free. All these programs are virtual right now. They're designed to help peers have the chance to sort of connect with other peers and get support, informal guidance, coping strategies. Hey, what worked for you when you were in crisis? What helped you the last time? So great resources for individuals. We've got similar programming for family members who want to understand how to maybe support their loved one, be the best advocate they can be, or just get support from other family members in terms of, hey, I am getting no responses from these crisis numbers. Resources for kids similarly, and young adults. And we also have some community presentations. I don't know if anybody's interested in that. We've got some really cool events coming up in April and May. So I'll send Carly that information if you guys want to get involved. It's always a good time to kind of pay attention to your mental health. And if anybody needs help getting started, feel free to call our helpline. It's not a hotline, it's just 9 to 5, but we'd love to help you if we can. And you're welcome to follow us on some of these social media platforms.
Welcome back, everyone. I'm glad you could join us again. we have a couple questions that we wanted to just sort of put out there before we wrap up. They are posted on the screen, and we're going to have Sarah respond to those questions. And that will probably be it. So we hope you had great discussions in your breakout room. Sarah, I'm going to turn it over to you to answer these questions. The first one that we kind of had was, are there people who can help me to create a crisis plan? And is there a guide for this? So take it away, Sarah.
Will do. And great questions. So yes, there are resources to help you make your crisis plan, but there's probably not one that's going to be a perfect fit for your family or individual unique situation. So for parents of kids under 18, we've got a really nice crisis plan on our website that I can shoot over to Carly for you guys. And it's sort of more geared at maybe anticipating more of behavior responses to crisis, because kids tend to have a little, that tends to be how they display their symptoms. It's just how they communicate effectively. And I don't think this is unknown to you guys, but you may, depending on the size of your kid, feel like when they're in a crisis or in a situation that you may not feel safe. And so having a crisis plan like that's really nice. Plus, if there's other kids, everybody knows what's going on. If you've got a loved one that's an adult, or you are an adult yourself, there are some ways that you can sort of plan ahead. In Virginia, we have psychiatric advance directives, which are like medical advance directives, except you can kind of talk about what care you want when you're in a psychiatric situation where maybe you aren't able to make those decisions for yourself. And so they can talk about, where you want to go in terms of care, what medications, who to call. So it's kind of part of the overall process, but you guys may want to finesse out a few more details. It doesn't always get into the minute, go by the place, check it out, but that is always a good attitude. I will say that for some of you guys, maybe guardianship is an option. I would say start with power of attorney first and see if that works. If guardianship is something that you just know has to happen because of risk of safety or other situations, you can apply for guardianship when someone is 17. So that's just something to kind of keep in mind, but of course, exhaust all other options first. And if you want to just if you have an adult loved one who maybe just needs to sort of start thinking about their own crisis in terms of what do they look like when they're doing really well, what do they look like when they're starting to go down that road towards increased crisis, we our peer-to-peer program does a relapse prevention plan with them, which is kind of a good initial activity before you maybe take on a legal document like a psychiatric advance directive. And so one other thing I just wanted to mention on that is I talked about levels of crisis, and this is really just my terminology. We want everybody healthy and happy, and that's unique for everybody. But whatever is your normal, and in parentheses, because normal is a moving target, but whatever your health, you're happy, you have connection, you have purpose, that's sort of when you're not in crisis. And anything between that point and sort of being a danger to yourself or someone else, I kind of view as a level of crisis. And so keeping, when people start to move down that road, how do you help them get out of it? So you can have strategies for different levels. The last question, who can I talk to in law enforcement beforehand? I would call your local PD's non-crisis number and just ask if they have CIT trained officers. They should know what that is. You can also look on, this is sort of like doing some extra sleuthing, but there's the Virginia CIT Coalition, and they have a website, and that does have the icon for all the localities that have CIT programs. But every CIT program is a local collaborative initiative between behavioral health and law enforcement. So they're going to be different. Some have, EMTs and fire and rescue being part of the CIT trained officers. Some don't, and some don't have many. So it's kind of, knowing what are your odds of catching a CIT officer, what's the frequency. So definitely call ahead. And when you call, just say, hey, I have a loved one who's in a behavioral health crisis. I would like to have a CIT officer come. If they're like, we'll do our best, then you may just want to pass along some other information that they need to know to kind of make the best outcome happen. Which is why I would say, as much as possible, have your own transportation plan. and try to make that happen. So thanks for this time. I hope you guys will reach out if you have other questions, and just thank you again.
Great. All right, and you're seeing here a couple resources that are coming across the screen. We will also take the resources that have been shared in the chat, and add those into the resources that we share for this as well. So thank you, Sarah, for sharing this information with us tonight. This was great. We want to thank everyone who was able to join us. And while we're closing out, I'm going to ask you, before I talk about the next meeting that we have, if you would, we would love to get your feedback. You heard me when we started saying that this was the first time we did this in this way. If you'd like to give us your feedback, we have two ways for you to get to it. There is a QR code. So, this is where you get out your phone and you put the camera up to it and you can scan it using your camera. And the survey for it will automatically pop up and you can do it on your phone. Or if you want to do it using a desktop, you can also enter the link that is in this as well. So the link will be here. We did not do a registration for this meeting. So if you want to go ahead and do that, please take a minute now and either scan or take down that SurveyMonkey link. And it's also in the chat if you want to click there as well. We'll have it recorded and you'll be able to get to it a little bit later, but please take a minute and do the survey. Let us know what you think. We definitely want your feedback. And if you would like to join us again, we will be doing another meeting just like this one. This is one that our next quarterly meeting will be held on May 20th. You might have heard us say these are quarterly meetings. Our councils pick the topics. It'll be on May 20th. Coming up from 6:30 to 8 o'clock. The topic we will announce a little bit closer to the time, but it's definitely something that families have picked. So please join us then. And in the meantime, I want to tell everyone, thank you for joining us. We had great participation on this. Thank you for Sarah. All you see here are speakers that were in our regional breakouts. So if one of these topics looks interesting to you and you did not happen in your breakout, you may want to reach out to someone from the other region to find out who the speaker was in their community if you want to know more. And if you are interested in having information about the regional experts, we've got that information in the chat as well. And I think that wraps it up for tonight. Thank you again. We appreciate it. And everyone stay healthy and safe. Take care, everyone. Thank you.